내게이션 하자. Nine implants are placed in left molar, first molar area. This alveoloplasty will be done. Okay. Let's see. But in right second molar area, I'm not sure the actual positioning. So I will open the flap. I'll check the vertical position. So in both left second molar implant area, I will not connect abutment and I will not connect provisional restoration. So accuracy is less important. But I will just check. 없어요, 맞지? 샘플 더 줘. 석션. 여기. And position of implant was not too bad. So I think this is a quite acceptable position. 고개 숙여 보실까요? Yeah. Okay. And then because this patient presented very thin gingiva, less than 2 millimeters, so deep implant placement was planned during planning. Yeah. Okay. No need to correct this implant position. Here, in anterior area, I will do GBR. 석션 해볼까? As I expected during planning, there was pre-existing labial bone defect here. 편에 밀지 마시고요. 아프면 말씀해 주시고요. 오케이. 블레이드. 응, 석션해. Here, the canine implant, labial surface of canine implant was exposed. So, to make appropriate bone support around exposed implant, I will do GBR with Smart Builder. 이거 줄까? Straight hand piece. Granulation tissue should be removed completely. Okay. So to get blood supply, I will make a cortical perforation here. 며칠 더 줘. 줘. 스마트 빌더. 하이트. This is an anchor for smart builder. The length, height of anchor is around 2.0. 먼저, for volume maintenance, I will use OSTEM, bovine bone graft material called AOS. This is AOS. 내가 꺼내놓은 거. To make a thick labial bone, the graft material thickness should be greater than 2.0 millimeter. 잡아줄 거야. 이거 4짜리로 줄까? 잡아줘. 응. 석션해. 아니면 커버캡은 없지. 커버캡 줘. 0.9X로.
0.9S로 드라이버. 0.9 드라이버랑 커버로 주세요.
빨리 줘요.
이거 아니에요. 다른 것까지. 하나 더 있을 거예요.
잡아줘.
커버코 여기 있습니다.
됐어. 이걸로 할게. Fixation was done. 들어갔다. Instead of healing cap, I will use cover cap. Because over this implant, we should deliver the pantic. So, and then, so I will cover this smart builder with the reservoir membrane called OneGuide. 빨리 줘요. 응. 수치할 거야 한 다음에. And this is reservoir collagen membrane. In this way, we can minimize the exposure of smart builder during healing. And primary closure 하게. blade. So for tension-free primary closure, periostal releasing incision will be done. 몇 분 남았어요? 오케이. 컷. Primary closure is done, almost done. Over the cover cap. Cross matrix suture will be done. From the GBI side, the primary closure is done. Now I will connect abutment and provisional restoration. So I fabricated 12 unit provisional restoration. For cross-arch stabilization, one-piece type provisional restoration was fabricated from first molar to second to first molar. First, this is K9. K9 I design. I fabricated catechin abutment in K9 and lateral incise area. 쿠션해봐라. 타이트닝. 더 긴 거. 빼. 당겨져. 이거 더 길어야 돼. 더 긴 거 줘. 그거 있잖아 저기 토크용. 응. 아. 그거 줘봐. 토크렌치 줘. 하나 더 줘. tightening around 20 Newton centimeter. Yeah. Okay. Two catechin abutments were connected from anterior implant. And let's check. 잘 당겨줘. 뒤에는 저 6번, 5번. 어바트먼 줘. 넣어줘. 석션하자. The second premolar area, I will use transfer abutment. 육 번이야? 안 보여. 힐링 줄게. 6에 5. 6에 7. 뒤에 거 좀. In the posterior area, I prepared this transfer abutment here. In the anterior area, I will connect again. 제일 긴 거 어떤 거야? 그거 하나씩 연결하자. 이것도 제거하고. First, I will connect this CAD abutment. Okay, this will be better. Okay. 하나 더. Final CAD abutment in right canine. Okay. Irrigation 해봐. So because of increased alveolar bone volume in this area, after GBR, there was some premature contact under the phantic base area. So tight fitting is impossible in this situation. But I will grind this phantic base area, and then I could get good adaptation of this provisional restoration. Yeah. Okay. Yeah. So during 몇 분 남았어? 3분. Okay. And here, the canine and lateral inside is a CAD abutment. Here, this transfer abutment. So second molar area, I will connect healing abutment. 625로 바꿀게.
625요.
오케이. 하고. So during taking panorama and CBCT, let's have a Q&A session. Q&A 해도 돼요? Okay. So I'll close the flap.
하나만 좀 빼주셔야 돼요.
됐죠? 네. 잠깐만 다시. 왼쪽. 다시 줄까? 아니 다시 템퍼러리. The suture was done and 들어오는데. 빼봐. 응? 하나만 풀자. I think there is some misfit in abutment. 이거 하고 okay. There is some misfit in canine abutment connection. So to correct, I will type again. Okay. Good. Okay. Yeah, it's better. 확인해봐. 그냥 해봐봐. 응, 됐어. 해봐. Yeah, so 9 implants were placed and GBR was done and prefabricated one-piece type provisional restoration was connected successfully. So during taking panorama, let's have a Q&A session. 물어보세요. 어금니로. 네.
Good afternoon, Dr. Kim.
Good.
Yeah,
Thank you.
You have good job. And we did the nice lecture and the wonderful live surgery. Yeah, you did. I think that at first this is online the live surgery.
Yeah.
And do you have any lesions, the special lesion for the selection of this case and such a subject?
Yeah. So today I placed the 9 implant for the fully edentulous patient. So I prepared this live surgery to show you the accuracy and high-end technology of OSTEM digital guide surgery system. That's my main reason.
Yes, maybe this is the OneGuide system. I think that Dr. Kim has many cases and many experience of the OneGuide. So the very beautiful surgery.
Thank you.
Yeah, and there are so many questions in the online, and I choose some questions. Maybe first one is when will you take the final impression? Maybe you did the temporary processes,
Yeah.
and you did. When do you have final impressions?
Usually in the mandible, if the bone is normal, I usually take an impression 8 to 12 weeks after implant placement. But in this case, we can make a final prosthesis at least 3 months after. But I perform the GBR, but I will take a final impression about 5 to 6 months later.
Yes. And another question is, do you have any plan for the upper arch?
Yeah, I have a plan in the next month. If possible, if the patient agree with my live surgery again, I will place 10 implant in the maxilla.
Oh yes, we do the sinus surgery.
Yeah, along with the lateral approach and GBR.
Yeah, we will expect the next month. You will do the many wonderful live surgery also.
Yeah, thank you.
And the next question is, How long will you wait for bone regeneration after GBR? Maybe the Smart Builder, OS Builder?
Yeah, I think after using the Smart Builder, we can get blood supply from the soft tissue. So when comparing Smart Builder to conventional membrane, we can expect fast bone regeneration, but we should wait at least 3 months to get full maturation of newly formed bone. So in this case, I will wait around 4 months.
Yeah, I see. 4 months later,
Yeah.
after then the removed.
Yeah.
And the next question is, maybe you did the immediate loading.
Yeah.
Do you have any your criteria for the immediate loading?
Yeah, to get successful immediate loading, we should consider several things. First, we should check the condition of upper arch. In this patient, we will use RPD or complete denture as a provisional restoration. So in this case, we can do immediate loading, but to maximize the success rate of immediate loading, we should splint several implants together. So cross-arch stabilization. So for that reason, I prepared one-piece type provisional restoration. And also, to perform immediate loading, the initial stability of implant is most determining factor. So at least 31 Newton centimeter initial stability is most important. So in this, today, all 6 implants presented high initial stability. So I can perform.
Yeah, and you did the anterior 2 is custom abutment,
Yeah, right.
and the other one is
Transfer abutment.
transfer abutment.
Yeah.
For the
easy fitting.
Yeah, I see. I understand.
Yeah.
And the next question is there any chances of tissue entrapment, especially using flattening drill?
Yeah.
And with the similar question, is there any chance of the resin materials lodging in the socket while drilling? If you how to can avoid such a tissue impingement or the resin materials?
Yeah. So that's a very good question. When drilling without removing the soft tissue core from the alveolar lid, the soft tissue fragment can be entrapped through the drilling hole. But many research about plenary surgery showed that there is no complication, even though the soft tissue fragment can be entrapped through the drilling hole. So we don't need to worry about that. But resin material can be grinded and can insert it through the drilling hole. But let's think about metal sleeve. Metal sleeve can be grind off and sink down to the drilling hole. But I think resin material is quite light. So during irrigation, this resin material can be drained out easily. So for that reason, I prefer the surgical template without metal sleeve. So to avoid that resin material entrapment, frequent irrigation. After every drilling, irrigation, and before implant placement, irrigation is quite good method.
Yeah, I think that Dr. Kim has many experience about the OneGuide, and maybe you already mentioned the metal sleeve and plastic sleeve, such as OneGuide. Yeah. Maybe the entrap of the resin materials is no problems. Yeah, I see. And another question is also the anchor pin and the Titan mesh, maybe the Smart Builder.
Yes.
Maybe you already
4 months later.
Yeah, 4 months later. Yeah, there are many questions, but we don't have enough time, so I'm so sorry. And we checked the post-operative X-ray.
Right. Let's see.
Please see. Yeah, very good.
Yeah. But actually, in this case, in the left lateral incisor area, I place implant deeper than my planning because to get high initial stability. During about until 80% implant placement, I could not get high initial stability, so I intentionally increased the installation depth. So there was just some gap between the margin of temporary bridge and the margin of catechal abutment. But I will do relining after surgery. Yes.
Yeah, I see. Very wonderful, the post-operative X-ray. And you can see the upper arch has the very remaining available height, especially the maxillary sinus area.
Right.
So we expect the next month, maybe we have also another good and wonderful live surgery.
Thank you for your wonderful moderating. Thank you.
Yeah, thank you very much. We don't have enough time, so we have to close this OSTEM meeting online, and we will meet the next time online, maybe the wonderful OSTEM meetings.
Yeah.
Yeah. Thank you very much for your attention.
Thank you.